Welcome to our 7-day training on the topic of next generation Nclex. Professor, who is this training for? Who should be watching this training from day 1 to day 7? Basically, anyone taking the Nclex now or taking the Nclex starting April 1st, 2023. But Professor, why am I going to be bothering about the next generation Nclex if I'm going to take the Nclex next week? Because it doesn't matter what the topic is, we are going to be talking about nursing. And I am pretty sure you will be able to learn something that will aid you, will help you pass either today's Nclex or the next generation Nclex. So I want to welcome everyone to this training. We have at this moment 417 live nurses all over the world connected to our next generation Nclex, and I am very, very happy to be here with you guys on this day. So what is going to be the main subject of our next generation Nclex 7-day training? Well, obviously the name kind of gives it itself, next generation. We're going to be talking about next generation and Nclex, but I have divided it into mainly two categories. And whatever the category is going to help you pass the Nclex. So the first category that we will be discussing during our 7-day training is we're going to talk about the different style of questions on the next generation Nclex. And I will teach you specific strategies that you can use to master these types of questions. In day 1, day 2, day 3, 4, and 5, we will discuss a variety of these new next generation style of questions. And also on day 1, day 6, and day 7, we will be discussing case studies style of questions. So we are going to review some case studies. We're going to talk about nursing, about critical thinking, about clinical judgment. So it's going to be some very nice case studies that you will be learning a lot. So do not move from your computer on these few days. 7 days is the commitment that you need to say, I will be there no matter what. I will try to see it live, preferably. But if not, I know that some of you might not be able to be here live, but it doesn't matter. You can see it recorded on our YouTube channel because I will leave it available for anybody that was not able to see the training live. You can see it in the recorded version here in our YouTube channel. So, Professor, what specifically are we going to discuss during this 7-day training? So I have created a calendar so you are very aware of what is going to happen in each one of these day training. So in day number 1, which is today, we will give you an introduction to the next generation Nclex. We're going to talk a little bit about what is this next generation Nclex and the different type of questions that you would encounter, but we will also discuss and cover our first case study. We're going to do 3 case studies throughout the 7-day training, and today we're going to cover the first case study. So yes, we will be talking about Nclex style questions today during this first day of our 7-day training. On day 2, we're going to talk about some strategies to answer multiple choice single response item. We're also going to talk about strategies to answer matrix multiple choice items, and we're going to talk about other strategies that you will learn as the days progresses. Day 3, we're going to continue with strategies part 2. We're going to talk about multiple response selector that apply items and multiple response select N type of Nclex items. So as you can see, I'm talking specifically about some next generation topics. Day 4, Strategies Part 3. We're going to talk about multiple response grouping items and matrix multiple response item. Day 5. It gets very interesting because we're going to talk about this new style of question, very complex, the bow tie items. That's going to be on day 5, and we're going to continue with other strategies, part 4, that we will be discussing in day 5. Day 6, another case study number 2, and day 7, case study number 3, and I will open the platform to also answer any questions that you have in general about the Nclex, habits that you need to develop in order to pass the Nclex, Q banks that you should be using, books that you should be using in this 7-day training. I will open the platform live and talk a little bit about questions that you may have. But that is not it. I know that this is awesome, but it's not it. Each day, I will be picking 3 candidates, 3 nurses that are in our training, and I will be giving you a free access to our Nclex Crusade International membership. You have been seeing some nurses talking about the membership that we have available. I'm going to discuss later on what we have in the membership, but I will be giving 3 of you through a raffle access to our Nclex Crusade International membership. Are you guys excited? If you're excited about this training, let me know. Comment in the comment section. Make sure you're liking this video. You have to like this video in order to help us grow, help this video reach where it needs to reach, help other nurses around the world that don't know about Nclex Crusade International. So we have about, 291 likes, and we have almost 500 attendees live in this YouTube training. So I am doing this out of my heart for free for you guys to help the community. The only thing I ask, hit that like button, comment, subscribe to our YouTube channel if you haven't done so, because you don't want to miss any of this 7-day training. Trust me, just because it's free doesn't mean that it's not worth it. It's going to be very worth it, very valuable to each one of you. All right? So if you are excited, that's the way to prove it. Show me that you're excited and that you like this training and that you want me to continue doing more trainings in the future. Well, Professor, how do I register to be one of those selected candidates for the free access to the Nclex Crusade International membership? I will ask my advisors to put in the comment section the link that you need to use to register. I will be posting it also here in the comment section and in the description of the video, so you have an easy access. But basically, here is the website in the PowerPoint presentation, and our advisors are putting also here in the chat. It's very simple. All you have to do is register with your name, your email, phone number, and there is a very specific question that I have asked and I want you to answer, and is, what language do you speak? The reason for that, what seems an odd question, is because in our academy we have a Latino or Spanish side and we have an English side. So we have basically a lot of resources for the Latino community because we've been doing Nclex review for 5 years with the Latino community. So if you speak Spanish and you would like to know some information about the Spanish side, we will be contacting you as well and giving you some information about what we have and how it can help you. Okay? So make sure that each one of you are registered here so you don't miss that opportunity to win that free access to the Nclex Crusade International membership. All right? All right. So to begin, a little brief presentation. If you don't know who is this guy with a funny accent talking to you, my name is Rainier Arado. I am a registered nurse here in the United States. I've been a registered nurse for several years already. And my wife and I, we have an academy that is called Nclex Crusade. And basically we help the nurses from all over the world prepare and pass the Nclex. So that is the main function of what we do. Basically, I take care of mainly the English side of the Nclex Crusade Academy, and my wife helps me in the Latino side of our Nclex Crusade Academy. Without her, this is not possible. So although she's not here, she's behind the computer helping and working here to make this academy a successful academy and help many of you pass the Nclex. On the more of the personal side, I am married to a beautiful wife. She has been a blessing in my life. It was a gift from God. I also have 3 children, a 17-year-old, a 13-year-old, and a beautiful 4-year-old as well. And as a father, I have been more than blessed. As a husband as well. I am Christian, so all the glory to God for me here. Everything that I do is because He gives me life, strength, and knowledge to be able to help you guys out there. Basically, we have in less than a year almost 50,000 subscribers on our YouTube channel, and I have very little knowledge about the YouTube world and all the strategies or whatever. I mainly focus on provide some good to the community, help others out there, help you pass the Nclex. So basically, that is what this training is going to be about. This is who I am, and I hope that this is a blessing for you. I pray to God that this is a blessing to you and to your family, and you pass the Nclex on your next attempt and become a registered nurse in the United States. All right? So let's begin. Let's begin with our day 1 of our next generation Nclex 7-day training. So as you know, starting April 1st, 2023, there's going to be a new exam, a new Nclex, and it's called the Next Generation Nclex. You're going to see about 85 to 150 questions total in this new Nclex exam. Nothing new. We have a video here on our YouTube channel that talks a little bit more about that. So I will be posting it here somewhere, the link, so you can see that training if you haven't seen it yet. So you get a little bit more information on the details of the next generation Nclex, but that's not the purpose of today's training. Basically, the nursing candidate will expect to see 3 next generation Nclex case studies. And each case study will have about 6 questions. So right there, we're talking about minimum 18 new style of questions that you could see on the Nclex. On top of that, you're going to see what is called a new style of question called standalone clinical judgment item, which includes one of the new NGN test items that we will be discussing as the day progresses. As day 1, day 2 of the training progresses. You could see, or most candidates will see, about 7 standalone items of these new types of question. So what this means is that you're going to see somewhere more than 20 questions that are totally new that nurses have not seen before. Why is this important? Why am I providing this information? Well, it's very simple. Many nurses ask me, Professor, everything else that you have in your YouTube channel or in your YouTube channels, because we have 2 YouTube channels, is that still going to be good for this next generation Nclex? The answer is yes. Yes, it will. Why? Because all the other questions is going to be like the old Nclex. So there's only a small portion of the next Nclex that is going to be totally new. But prioritization and all the other type of questions, you will see it on the next Nclex as well. So what is the NCSBN definition and model of the clinical judgment? What is this about clinical judgment, and why do I need to care about that? Clinical judgment is defined as the observed outcome of critical thinking and decision making. So what the new Nclex want to do, they want to really evaluate if you as a nurse have developed your critical thinking and decision making abilities. So it's no more or no longer seeing a very simple basic type of nursing content question. You really need to master your critical thinking and clinical judgment or decision making abilities. And one of the things that you will see in our YouTube channels is that our main focus is critical thinking. Our main focus is to guide you through the analysis process of an Nclex style question. As you can see, I almost never only discuss content in any of our videos. I like to go in details in analyzing each specific question, show you the ability to identify what is important, what is not important, and how you can use critical thinking strategies to get to the answer. Now, is this channel able to show that through all of our videos, whether it is live or recorded? The answer is yes. Stroll through our YouTube channel and listen to the video. Each one of you should be seeing each videos. You should be completing all the videos in this channel, and not only see it once, you should see it several times. The reason why is not to give me views. The reason is because it takes time to master that ability. So what are the 6 NCSBN clinical judgment measurement model of cognitive skill? How is it different? Well, you need to have the ability to recognize cues, to recognize important data. We're going to be talking about that specifically in day 2, strategies part 1. You need to know or have the ability to analyze cues. We're going to discuss that in day 3, strategies part 2. You need to develop the ability to prioritize hypotheses. So you need to think of what is the most important condition, or what is the most important vital sign, what is the most important lab that you are encountering in that question. We're going to talk about that in day 4, strategies part 3. You also need to develop the ability to generate solutions. We're going to talk about that in day 5, strategies part 4. And you need to have the ability to take action, otherwise known as a nursing intervention. And we're going to talk about important nursing interventions in different scenarios in day 6, strategies part 5. And lastly, you need to develop the ability to evaluate outcomes. And we're going to talk about strategies about evaluating outcomes in day 7, strategies part 6. As you can see, this is not a training that you're going to see it today and you're going to go, I don't need to see day 2, day 3, day 4, day 7. That will be a costly mistake. You need to make the commitment today. If you're really serious about your Nclex preparation, you have to make the commitment that you will see day 1 to day 7. And let me tell you something, based on my experience, it never happens. How do I know that? Well, I see 400,000 views on day 1 and I see 200,000 views in day 2. What happened? Does that mean that 50% of the attendees in day 1 never saw day 2? My question is always, why? And the answer is very simple. We get very distracted. We are so distracted with technology nowadays, with your phones, with Facebook, with Instagram, with TikTok. Forget about Facebook, forget about Instagram, forget about TikTok. If you really have the desire to become a registered nurse in the United States, you need to sacrifice, you need to stop the whining, and you need to say, I will be doing everything that needs to be done to pass this test. Professor, it's easy for you to say. No, it's not. I've been in your shoes. I know it's a struggle, but what are you going to do? Cry about it or stand up, face the adversity and say, I will do it. Professor, I've done it 10 times. Doesn't matter. Get up. Do it 11 times. It doesn't matter how many times you try. Pass the Nclex and become a registered nurse. And then your life will change. So let's talk about recognizing cues. What is that about? Why do I need to know how to recognize cues? Well, what are cues to begin with? What is that? Well, cues, I have another name for it. I call it identifying the key factors of an Nclex question. So basically, you need to identify, you've heard it, you need to identify who the patient is, what is the patient problem, what are the clinical manifestations, do you have subjective or objective data, do you have keywords, is this a priority question, is this a case study question, what type of question are you facing? So that is what recognizing cues talk about. And we're going to go in details about this. So a good next generation Nclex tip I saw in one of the Saunders books. Remember to recognize cues carefully, review the client assessment data like developmental age and history to determine if findings are relevant or of immediate concern to the nurse. I will tell you something about this next generation Nclex. They're going to give you a lot of information. They're going to bombard you with information. They're going to give you a clinical picture this big, and out of that information, maybe a third of the information is important and everything else is blah, blah, blah. So if you don't develop the ability to recognize what is important, you're going to be wasting a lot of time with things that are not important. So you need to write those 5 key factors that I talked about a few seconds ago. You need to write them down and you need to look for that as you review your question or your case study, whatever it is. Number 2, another ability that you need to have. You need to have the ability of analyzing cues. The nurse organizes and links them to the client's presented clinical situation. You need to ask yourself, what is relevant? What does it mean? And what does it indicate? See, in these type of questions, they are very difficult. And sometimes it even looks like, I would say, like almost diagnosing type of questions, like medical diagnosis. But the Nclex doesn't really test medical diagnosis. The Nclex tests nursing diagnosis, nursing implementations. But you could see questions like this. You can encounter a very difficult question like this. For example, they may say that you have a patient that came to the ER. This patient has weakness, acute confusion, the patient is dehydrated, and so on. And they're going to ask you what the clinical manifestations are, what is it telling you as a nurse. But you know what? It gets trickier. They're going to ask you how those same symptoms, how it relates to other medical conditions. The question could be about dehydration. The question could be about sepsis. But they're going to ask you how these symptoms described in the scenario also relates to other medical conditions. So now those type of questions take a completely different turn. Now it's not only about knowing about dehydration. You need to know how those symptoms that are related to dehydration could also apply to conditions such as hypernatremia or anemia. So as you see this question here, and if you're watching this recorded later on, pause it and ask, where do I see generalized weakness? And mark dehydration, hypernatremia, or anemia, and so on. You need to identify acute confusion. Where can I see those type of symptoms? Dry mouth, increased heart rate, dyspnea on exertion. So think about that, about this specific question, and check mark where do you see those clinical manifestations occurring, because this could be an Nclex question that you could see on the next generation Nclex. So generalized weakness, where do we see that? We're going to see it on dehydration, hypernatremia, and anemia as well. Acute confusion, we can see it in all of the conditions: dehydration, hypernatremia, and anemia. Dry mouth, dehydration, and hypernatremia. Increased heart rate, we can see on all of them. Whether dyspnea on exertion, we see it mainly in anemia. So this is an interesting style of question that you can see on the next generation Nclex. Let's talk about prioritizing or prioritize hypotheses. What is that about? With this ability, you need to develop the technique or ability to narrow down what the data means and what is the most important. So this is not very different than what I have been discussing with you on the other 7-day trainings. And talking about the 7-day trainings, if you haven't seen the first 7-day training I did and the second one about pharmacology, you're missing a lot of information. So make sure, if you haven't seen the other 7-day trainings, you go back to the YouTube channel and you see those live trainings, those 7-day trainings, because they will help you. And it will create a foundation for you to have better success on this new Nclex. So what does this mean? Let's say that the clinical scenario is as follows. A 42-year-old postpartum client who just gave birth to a third child in 4 years reports severe afterbirth pain of 9 out of 10. So in your mind, you have to be identifying some key factors. For example, the age, 42-year-old, gave birth to the third child. So it's a multipara. It says that the patient now has severe pain. So it's describing, using an adjective to describe the severity of the pain. Severe, 9 out of 10. That is important. So we see right now that the first problem is pain. Is there any other problems? Keep reading. The client also reports, that's a keyword to tell you there's more. What else? What's happening? Well, also reports problem with the baby to latch for breastfeeding. So that is another problem that we have. Breastfeeding problem. But then he says, the nurse conducted an assessment. You see, up to this point, all we have is referred information from the client. Pain, difficulty with getting the baby to latch. But now, the nurse did an assessment. Is that important? Of course. Of course it's important. It can help you prioritize. So the nurse assessed that the client has a bulgy uterus and is, keyword here, saturating a peripad every 20 to 30 minutes. Why is this word important? Saturating. Saturating the peripad is telling me that this patient is bleeding. And the bulgy uterus tells us what's going on, why they're bleeding. So as we analyze this question, we have to formulate a hypothesis and prioritize what is the problem. Not only identify what is going on, but we need to identify, out of all the problems discussed in the scenario, what is the most important. Because if you don't understand that, as the questions progress, then you're going to find a lot of difficulty answering that type of question. So if we look at this scenario, how will you put it in order? What do you think will be the order of prioritization in order to formulate future care or future nursing interventions? Well, if we go back to the basics, we go back to prioritization guidelines, we know that Maslow's hierarchy of needs says that any physiological problem such as airway, breathing, circulation has the priority. So we know that the bulgy uterus and saturating peripads every 20 minutes, that is probably my priority because that indicates bleeding. Well, what will be second in priority? Well, the severe pain. We have to take care of that pain as well. What will be third in priority? Well, teaching the mother about the proper technique for breastfeeding. So, why am I telling you this? And what is the mistake that I usually think that you could encounter when you're dealing with a question like this? If you're just reading and not really thinking through as you read, you're gonna have to go a second time again and reanalyze the question once you see the prioritization question that is gonna come after this. But if you already have a structure in your mind, okay, yeah, I see that it has three problems: pain, difficulty with latching and breastfeeding, and saturating peripads. Oh, big problem here. This is ABC. That is my priority. Whenever you see a question that says, according to this scenario, what would be the most important action for the nurse to make? Your first thing is going to be bleeding needs to be somewhere around here. Because you already analyzed the scenario with really putting details or looking at the details of the question. That is only a part of the clinical judgment process, okay? I'm only discussing the clinical judgment process, okay? We're not really going in details here. Generate solutions. What is this? What is generate solutions? Well, basically, you have to think about what nursing interventions you can do to help with the most priority problem described in the scenario. So after identifying the client's priority, giving in the scenario, you want to think about all the possible actions that can be used to resolve or manage the problem. Now, let's switch gears here. So let's say that the clinical case, the scenario was about a patient with difficulty breathing. You got to say, well, what can I do to help a patient with difficulty breathing? Elevate the head of the bed, administer oxygen with let's say a face mask, high flow oxygen. But what if they tell you that the patient arrived unresponsive via EMS, the patient is in respiratory distress, severe hypoxemia, low pressure of oxygen. You have to generate solutions. What could be? Well, this patient is unresponsive. This patient needs priority or immediate intubation. We have to think about possible CPR. Does the patient have a pulse now? Did something change? What can you do? Do I need to call the rapid response team or the code blue, depending if the patient has a pulse or not, depending on how the scenario progresses. But you have to start thinking on generating interventions, nursing interventions to assist with the patient's problem. Or the patient came with sepsis and has severe hypotension. What is the priority nursing action there? Well, then you will be thinking about administration of fluids, administration of vasopressors, administration of antibiotics if it's sepsis. So the prioritization will change depending on how the clinical scenario was developed. Remember, to generate solutions, you need to prioritize client needs. So prioritization is still important for the next generation Nclex. If anybody else told you otherwise, they lied to you. If somebody told you that you only need to worry about content for next generation Nclex, they lied to you and stole your money. Because next generation Nclex is really going to be about prioritization, about really understanding what is going on with your patient. Because guess what? That is what happens during real life scenarios. That is what will happen to you when you go first on shift. You're gonna take care of your patient, and they tell you, run your patient in 310. Oxygen is very low. What are you gonna do? So once you generate a solution, you think about possible nursing actions that you can take. Well, it's time to take those specific actions. Decide which action you will implement first, how you will implement those actions. So you need to determine the most appropriate intervention or combinations of interventions that will resolve or manage the client's priority health problem. So when you're deciding to take action, listen to this, good tip from Linda Saunders, avoid memorizing textbook methods and procedures. Instead, customize your actions to meet the needs of the client in the clinical scenario. What is this saying right here? Forget about memorizing nursing content, reading a book and memorizing everything and thinking that you're going to do great on the Nclex. No. This is a good tip right here. It's not about memorization. It's about understanding. So now you really need to be strong in both content, but even stronger in critical thinking. Because guess what? You will never find an answer in a book. You're not going to find answers to these case studies and critical thinking studies in a book. You're not going to find it. Why? Because it all depends on how the scenario is described. And lastly, evaluation of outcomes. The last clinical judgment thinking skill is to determine if everything you did was successful. If your nursing interventions help the patient. And how do you do that? Well, very simple. The best way to determine this is to compare what your original plan was. Example, patient with difficulty breathing, let me give oxygen. and then looking at the O2 saturation and saying, oh, wow, it went up. So the O2 saturation was 89, now it's 94. Oh, great. My nursing intervention was the correct one. Or the patient was in pain and you gave pain medication or whatever. So you need to ask yourself, which assessment findings or signs and symptoms indicate that the condition improved? Oh, wait till you see these type of questions. Very difficult questions in case studies, but very interesting. I'm passionate about this next generation Nclex. To be honest with you, I like it even more than the Nclex now. I think that now they're really going to test the abilities of a nurse to take care of a patient. Some nurses ask me, is it going to be more difficult? I don't think it's going to be more difficult. I think it's more balanced. And also, since the analysis on your answers or the way they're going to look at your answers is a little bit more fair. Since you have partial credit, partial points, so that's going to help out as well. So it's gonna balance out. Right, everything you've mentioned here, I think I heard about it somewhere. Yes, you did. You've heard about this. This is nothing new. Where did you hear about this? Well, first in nursing school, I hope. You know the nursing process, right? The famous ADP, assessment, diagnosis, planning, implementations or interventions, and evaluations, right? Same thing here. But now they have put this together in a clinical scenario, and they ask you in different style of questions, whether it is a case study or not a case study. They're gonna have you really put everything together. Nursing content with clinical judgment. And in a few slides, this is what next generation Nclex is. In small details. I haven't gone in depth. We will go in depth as the training progresses. So, do you like this training so far? Let me know. I better see some yes somewhere, because I've worked very hard to create this. So, are you interested in this training? Does it touch the buttons that tells you, yes, I want more? Yes, I want to know more about this next generation Nclex. So if the answer is yes, go ahead and comment yes. And we have 625 live nurses now, only 491 likes. Uh-oh, we got a problem here. Help me with that. Come on, let's push this video so every nurse in the world right now preparing for the Nclex can see it. Help me with that. I really want to show these videos and this channel to every nurse in the world, because there's many nurses out there that don't have thousands of dollars to pay a mentor. And this is for free, completely free. So copy the link, share it on Facebook, share it on WhatsApp groups, on Telegram groups, put it all over the place. I want to see tomorrow here, double, 1,200 nurses, live. We can do it. We can really help and make a difference. But if you don't do anything, if you just keep it to yourself, guess what? Only you're gonna see it. So how will these 6 clinical judgment skills, how is this that I've mentioned over the past 20 minutes, how is the next generation Nclex going to test this? Well, that's a very good question. And we have a very good answer. So the next generation Nclex will measure clinical judgment through the use of a variety of new test item types. And they're going to be divided mainly into two types: the unfolding case study and the standalone item. Professor, you're speaking Chinese today with the accent and all these all these different words. You're speaking Chinese. What is this? What is this unfolding case study and the standalone item? That's just a very different word to say a case study on the Nclex. And a case study basically is a scenario that unfolds, means the patient comes to the ER, then goes to ICU, then gets better and goes to a step-down unit, and then gets better and is discharged home with home care. So that is an unfolding case study. You're going to see questions that have to deal with that, okay? You see this camera is acting up now. Hello? Wakey, wakey. Let me turn it off and turn it on again. I think I was moving too much and it went out of. There you go. So that's basically what an unfolding case study is. So what is a standalone item? Standalone item, basically, they will also give you a case study or a clinical description, but it does not unfold from one scenario to the other. Basically, patient comes to the ER, he has this problem, this and this and this has been done, and then the question. In both types of clinical scenarios, in both type of cases, there's going to be a medical record information, either doctor's note or nurse's note or doctor's order, vital signs or laboratory values that they will provide to you in that specific question. Okay? And basically, the focus of today's training, day one, I want to talk about a case study. Okay? So in the Nclex, you will see two types of case studies. So what are the two types of case studies that you will see? Well, the standalone, you're going to see a case study with a simple structure, or the one I just mentioned that is unfolding, that it goes from one end to the other end. Although there are some differences between these two types of cases, there are also some similarities that I want to discuss, but the main focus is to present to the nurse a realistic clinical situation. In other words, they're just getting situations from nurses that have experience in the past and they're putting it on an Nclex question. So let's look at the similarities or differences between the standalone item and the unfolding case study. Notice that both of them, they're going to be based on realistic clinical scenarios, clinical situations. So no difference here. This is the same. The standalone item, they're going to give you a clinical situation for one specific question. In other words, they will give you a lot of information for one question. In unfolding case studies, they will be an unfolding case and you will see 6 next generation item questions. Why is this important? The real importance behind this is that the clinical situation or case study with one item is going to follow the trend of your ability that you have acquired as you go through the test. The case study is different. It has kind of like his own mind. The case study has its own analysis within the big test. Don't ask me to describe more than that, because that is in-depth analysis on how the test analyzes questions that I have no idea. Okay? But that is a difference between the standalone and the unfolding one. Unfolding one. The about time items provide a client situation at one point in time, and the trend item presents client information such as vital signs, assessment finding, IOs, over time. So that is on the standalone item. Whether unfolding case studies presents a story over time through several phases, like I told you at the beginning. The phases could be in minutes. In other words, the patient came and this happened. 30 minutes later, that happened. An hour later, that happened. Or it could be the patient came to the ER today was transferred to the ICU, 3 days later went to step down, and then 4 days later discharged home. So it can be, the time can be either in minutes, hours, or even days. And both style of question will have information presented as a medical record format. In other words, it's going to look like if you're really looking at the chart, at the patient chart. That is the feeling that they want to create. That is the feeling that the Nclex want to create, that you basically are in a real scenario in a hospital. Okay? All right. The unfolding case study, also known as the next generation case study, will describe very specific keywords that you need to identify. One of the main keywords that they will give you in this type of question is the location of the patient. See, now more than ever, location is critical. Where is the patient? In the ambulance? At home? Is the patient in the ER? Is the patient in ICU? Is the patient in a telemetry unit? Is a patient in a med-surg unit? Where is the patient exactly? Because these type of items require for you to use all of the information, including the information in the current phase of client care, but also previous phase in client care. What do you mean by that, Professor? Well, you could be in a part of the case study that the patient was already or is already in a step-down unit, but you need to see how the patient came to the ER in order to answer that question. What is an example of that? Well, the nurse did XYZ treatment, identify if the patient has an improvement or no improvement. So how do you know if there was an improvement with just now information? You need to look at information from the past to see, well, the patient came with an O2 saturation of 85 and now has an O2 saturation of 95. Improved. So you need to look at those details. So time, place is very important for case study questions. A very basic strategy that I want you to write down for case studies. This is very basic. We're going to talk more in depth later on. Remember to first identify what is normal or usual and what is abnormal and unexpected. Identify what information is relevant and not relevant. Identify what information requires follow-up and what information doesn't require follow-up. Look at strategic or keywords to identify complication, severe, versus mild. History of versus now reports. Keywords as suddenly, increasing. So those keywords will tell you if the information is relevant, important, or not important. Pay attention to the information provided in each tab. Remember, this is completely different than Nclex Now. Nclex Now, there's no tabs. Nclex Now only give you exhibits. But now you will have tabs. And it's very hard for me to show now, but we will see it later. You can switch from nurse's note to vital signs tab to doctor's order tab. So you have to go through each tab in order to answer a question. Don't think, oh, I just got to look at this information to answer the question. No. You have to go through each tab in order to answer the questions. Okay? All right. So we are about 1 hour into this training. So it's 6 o'clock. So we're going to go through our first case study. We're going to be done probably in about 15 minutes. No more than that. We will go quickly through this first case study. I only want you to see and have a feeling how the unfolding case study questions look alike. Okay? So relax, enjoy. If you want to answer as you go ahead. As I post the question, we're going to see 6 questions. If you know the answer, go ahead and comment in the comment section if you want to, or if you want to keep it private, no problem. Okay? All right. It says, Mr. John Smith, comma. And here's the first thing that I want to teach. In the Nclex, they're not going to give you a name. They're not going to give you John Smith. They're going to tell you a 75-year-old white male. This is a good strategy that you can do. Give a name to your patient. What's the difference, Professor? Why is that important? Giving a name somehow makes your brain focus and concentrate a little bit more because you're kind of putting a face to the scenario. It works for me. I hope it works for you. If you don't like it, no big deal. You don't have to do it. But I like to put a name to my patient. So Mr. John Smith, because the original question says a white male. So Mr. John Smith, a 75-year-old white male, has a history of mitral valve regurgitation and left ventricular failure. Why is this important? My patient is a cardiac patient with 2 conditions: mitral valve regurgitation and left ventricular failure, heart failure. Mr. Smith came to the emergency department with symptoms of increasing shortness of breath over the past week and was transferred to the ICU. So let's do the keywords here. Elderly male, mitral valve regurgitation, left ventricular failure. The patient came to the ER, now transferred to the ICU, but they're giving me information, clinical manifestations. Shortness of breath over the past week. So the patient now has respiratory problem. So this cardiac problem is manifesting as a respiratory problem. The ICU nurse immediately goes to check on Mr. Smith and notice the following. So now, where is the case scenario centered? In the ICU. So you need to know that. He indicated that he feels very short of breath. Why is this important? he's talking. The patient is talking because he indicated that he feels short of breath. Hey, very short of breath. The nurse noticed that he was laying in bed, pale, with circummoral cyanosis, and respirations appear labored and rapid. So now the nurse conducted an assessment and noticed that the patient is laying in bed. Is that important? Yay! The patient is laying in bed. That position is not good for difficulty breathing. So I wonder if a question comes related to that. Maybe, maybe not. But that is important to keep the back of your mind. So the ER nurse put some notes how the patient came. The patient came awake and alert. Took vital signs, 110/85, a little tachycardia, O2 saturation 89, respiratory rate 26. So we have some respiratory difficulties here. The nurse in the ER gave furosemide 100 milligrams IV, and the patient was placed in oxygen via nasal cannula at 4 liters per minute. So here comes the first question. According to this scenario, what is the action that the ICU nurse should take first? Listen to breath sounds. Ask when the dyspnea started. Check the oxygen saturation, or place the client in high Fowler position. So now we have a priority question within the case study. So what do we have to do? We have to relate to the case scenario and see which question is more pertinent. But since this is a priority question, I need to say, what is my first action to take? I have to think of a prioritization strategy. And there are several strategies that you can use here. I'm not going to go into details because that's not the purpose of this training. But you can use here the assessment versus implementation strategy. You can use here the changing position strategy. You can use here the Maslow's hierarchy of needs strategy. The correct answer is answer number 4. Why? Why is answer number 4 the correct answer? Because my patient has difficulty breathing. My patient is pale with circummoral cyanosis. Respirations are labored. That position that I found the patient laying in bed is not helping. So changing the position will help with A, B, C. Professor, why not 1? Why not listen to breath sounds? Because this is an emergency and I need to implement and not do an assessment. So 1 is eliminated. Why is 2? An answer that I will eliminate. Same thing. Assessment. It's an emergency. I need to implement. Plus, when did the dyspnea started? It's not really that important. It's not going to help me fix the problem now. Why not check the oxygen saturation? Well, important question here. Do I need to know what the saturation is now? Yes. I need to know. This answer number 3 validates the scenario. But why is not the priority? Because in a medical emergency where the nurse has already conducted some assessment, the priority will be to implement, not to assess. If you don't know what I'm talking about, you can learn about this strategy in the first 7-day training that I did almost a year ago. Let's go to question number 2. Notice how the time frame changes 2 hours later. So 2 hours pass by. The patient's still in ICU. Okay? Unless they tell you that the patient is somewhere else, the patient is still in ICU. The last current place. So 2 hours later, the ICU nurse goes sees Mr. Smith and notice the following. Crackle audible through both lung fields. Uh-oh. Client is coughing up pink, frothy sputum. There is now jugular vein distension. Oof. We see a drastic change in 2 hours here. The BP 115/85, heart rate 108, not much change there. Peripheral pulse 2 out of 4, with a capillary refill time of less than 3 seconds. Oxygen saturation is 85, with the oxygen at 4 liters per nasal cannula, and now the respiratory rate went up, 38 breaths per minute. There is 3+, 4+ spinning edema in her feet and up to the mid-calf. So you see that the scenario progressed. The question is the patient better or is the patient worse? The patient is worse, right? But notice how this question now is not really a priority question. It's a understanding diagnosis question. Based on the history, the nurse will be most concerned about which complication. This is a very difficult content question. Why? Not only you need to know what this clinical scenario means, but you also need to know the clinical manifestation of pulmonary edema, cardiac tamponade, pneumonia, and pulmonary embolus in order to identify if this scenario is one of these. So, what is the answer, Professor? The answer is pulmonary edema. Answer number 1. I see some of you putting answer number 2, number 4, number 3. So, why is not cardiac tamponade or tamponade, depending on how you pronounce it? Why not 2? Because in cardiac tamponade, we will see a high pulse and a very low BP. What do we have? Normal BP and a little bit tachycardia. Okay? And another thing that we will see weakened peripheral pulses. So we will not see peripheral pulse 2 out of 4. We will see weakened peripheral pulses. So, cannot be cardiac tamponade. Okay? So, why not pneumonia? Why is this scenario cannot be pneumonia? Because the trend and how the patient change looks more of a complication of heart failure than an infectious problem causing pneumonia. So 3 can be eliminated. It's not described as pneumonia. Why can it not be a pulmonary embolus? That is a good question there. Why not pulmonary emboli? What do you think? what is a pulmonary emboli? Or when does a pulmonary embolus occur? When a blood clot goes to the lungs. Where does the patient have, it says mitral regurgitation, mitral insufficiency. Remember the diagnosis at the beginning? So the problem is on the left side of the heart. So a blood clot on the left side of the heart will not cause a pulmonary emboli. If there is the development of a blood clot, it will go into the systemic circulation. So answer number 4 does not make sense. Final answer is 1. Based on the client's current medical condition, we're still in the same phase. What action are you going to take? So you know that 2 hours pass. The patient is coughing up pink frothy sputum. Jugular vein distension. We got oxygen saturation of 85 at 4 liters per nasal cannula. Respiratory rate at 38. What is your priority action? What is your next action? 1, activate the rapid response team. 2, switch to a non-rebreather mask at 2 liters switch to a non-rebreather mask at an O2 flow rate of 15 liters per minute. 3, assist the client to cough and debreathe. And 4, administer the prescribed morphine sulfate 2 milligrams IV to the client. There are also several strategies that we could use here. First strategy I can think of, do I need to call the rapid response team or do something now? In other words, is there something that I can do now that helps my patient with the current problem? Is there a nursing intervention that you can do as the nurse? So that is the question you need to be asking. So calling the rapid response team is not something that will help the patient immediately. So if I can do something that helps, I need to do that. So number 1 is out of the picture. So I have 2, 3, and 4. Am I really going to worry about asking the patient to cough and deep breathe in this scenario? In a patient that has jugular vein distension, 85 O2 saturation, all these respiratory problems? No. You need to do something to fix or help with the oxygen problem. That is the priority. So 3 is eliminated. 4, administer the prescribed morphine sulfate 2 milligrams IV to the client. What is the priority? The priority would be to give a higher flow of oxygen. Why? What is the client receiving now? 4 liters nasal cannula, O2 saturation 85. This is not helping. I need to do something else to help with the breathing problem. "15 minutes later, the client condition is the following. The patient is confused. Remember how the patient came to the ER? Awake and alert. Now he's confused. 15 minutes later. Labored respiration. Look what happened to the BP. 80/40. Heart rate 65. Wow, that doesn't make sense. With that low BP, the heart rate should be higher. to compensate, right? But the patient cannot compensate. Respiratory rate 32 and oxygen saturation still 84. After what? After the oxygen that you gave, that you increased the flow. Remember, that's into play. Your actions are into play, what you've done so far. Now they're giving you an ABG, so you have to interpret the ABG. I hope you know how to interpret an ABG, right? If not, there's a video here in our channel where I teach how to interpret an ABG. So pH is 7.30, acidosis, CO2 is 60. We have high CO2. So we have respiratory acidosis. The bicarbonate is doing absolutely nothing. So we have uncompensated respiratory acidosis and an extremely low pressure of oxygen that is 64. The normal is 80 to 100. Creatinine, borderline high, 1.1. BUN, same, 22. Sodium, 132. And potassium, 5.2. So here are new doctor's orders. Repeat the administration of furosemide. Insert a Foley catheter. 12 lead EKG. Assist with endotracheal intubation. And bolus administration of ringer lactate with albumin 5%. Highlight which doctor's order will the nurse implement. So this is a highlight type of question. So let's think of prioritization. What is the priority? What has been the core main problem now that the patient had? All throughout the case study, the patient has been declining respiratory wise. Is there an answer that deals with a respiratory response? Can I do this action and help with the patient's problem? Yes. Answer number 4. That is the correct answer. Now, does it make sense? Does the patient need intubation? Yes. Pressure of oxygen 64, decompensated or uncompensated respiratory acidosis. The patient is declining rapidly. We need to take care of that airway and breathing. Why not one? Why is that not the next action to take? The priority order to follow. So the furosemide will help with the edema. The creatinine, although it's borderline high, 1.1, I can still administer the furosemide, but it will not help immediately with the respiratory problem. A patient in ICU definitely needs a Foley catheter to measure the output, but it's not the priority. A 12 lead EKG, it would tell me how the heart is doing, but it's not the priority over airway breathing. And I hope that nobody selected answer number 5, because administering colloids, albumin with crystalloids, LR, you're going to give more potassium, more water, and you're going to kill the patient. Why is that answer there? The BP is so low that nurses think, oh, low BP, I need to give fluids. If I give fluids, it will help with the BP. Yeah, but in this scenario, you will really kill the patient. Question number 5. The nurse comes back the next day for another shift, and he's taking care of Mr. Smith again. So this is the next day. The nurse assesses the following: which data indicates improvement or not improvement. So we have to look at each clinical data. Lungs, inspiratory crackles at lung base. Is there improvement or no improvement? Then we got to go back to the scenario. It says crackles audible throughout both lung fields. So now we have a little improvement, don't you think? Have a little improvement. Why? Because it says inspiratory crackles at lung base. So there is an improvement there. So we should say, yay, improvement here. O2 saturation at 91. Is there any improvement there? Well, yeah, before was 85. So improvement. Professor, where's the improvement with the crackles? Well, remember it was throughout the lung field. Now it's at the lung bases. So it's not a complete fix, but it's a little bit better. Saturation definitely is much better. 3+, 4+ spinning edema, no improvement there. Systolic murmur, audible. Ooh, this is tricky here because it doesn't mention anything about systolic murmur in the case study. So this is a curveball. No improvement. But how do I know, Professor, since it was not mentioned in the case study? Well, systolic murmur is expected in mitral regurgitation or mitral insufficiency. That's part of the clinical condition. So if it's still there, that shows no improvement. And the ABG definitely looks much better. The pH went up. CO2 went down. And bicarbonate went up. So now it's compensated. So we have a fully compensated respiratory acidosis with a pressure of oxygen of 85. So remember, the pressure of oxygen was very low. So now it went to normal. So this would be the answer. The good thing about this type of question is that if you miss some of the answers, you still will get partial credit. Let's look at the last question to wrap up today's training and see who's going to be the 3 lucky winners. Well, I don't like to use those words, lucky, and we're not betting here, but I guess the ones that the system is going to pick. Upon morning rounds, the healthcare provider has determined to transfer Mr. Smith to the step-down cardiac unit for several days prior to discharge. Prior to transferring Mr. Smith to the step-down unit, the nurse should take which of the following actions? Select all that apply. So this is a regular, select all that apply. You could see here, select N, all that apply. We're going to talk about that it tells you specifically how many answers are correct. But to make it simple in this first case study, I wanted to keep it simple. So take the client's vital signs, definitely. Before you transfer a patient, you need to take vitals. Notify the family of the transfer, definitely. That needs to be informed. Call the step-down unit and give nurse-to-nurse report, definitely. Another important answer. Remove cardiac telemetry monitor prior to transfer, no. Why? This is a cardiac patient. Remember the original diagnosis? Heart failure, mitral valve regurgitation. Does that patient need to be in continuous cardiac monitor? Yes. 5. Request the UAP to gather the client's personal items to be transferred with the client. Well, of course, we need the client's property with the client. Let me know, did you like this first training and the case study that we created for you? Did you enjoy it? Does it make more sense now? Let me know in the comment section what you think. And let's go with the free candidates that will receive free access to our membership. I'm excited for that too. All right, let me see. We have, wow, thank you. We have 623 likes and 666 live viewers. So that's pretty close. Thank you. I think this is the first time it's happened. So thank you for doing that. And the few that are still there that haven't clicked like on the video, go ahead and do it. All right. All right. So I've mentioned that throughout the days, the 7-day training, I will give free access to our membership. But before I give you the free access, I want to know what will you get access to. Makes sense, right? For me to tell you what are you getting. So for the candidates that we select, basically the first thing that you will do is you will get access to our on-demand videos in our membership International Academy. Right now, it's not a huge database, but the information there is drastic for your success. There is no nonsense information here. Everything is important for you to improve critical thinking. The first category, strategies. You need to master that. ABG, chest tube, infections, EKG, dosage calculation, safety, different management of care, style of questions, different Nclex categories that you need to master. But one of the best things that we're doing now, drink some water, I'm kind of dry. One of the best things that we're doing now, we are doing about, not always, but about 2 live classes on Zoom per month. So if you have the membership, you will have access for free to those Zoom live classes. Some months I do 1, some months I do 2, sometimes I do 3. It depends on my schedule. But it's just something extra that I give for free. Okay? I don't have to do that, but I do it for all the membership members. So let's find out. Who are we gonna pick? Okay, let me see. Can you see this? I hope you do. So I have put here, at the moment that I selected the, I looked at the data out of everybody that have subscribed. At the moment, we only had about 285 nurses that registered. So if you haven't registered yet, I will post the link here in the comment on the video so you can register and be one of the winners for the raffle. So basically what I will do, I will click on this thing. I don't know what this is called. Can't remember the name now. But I will click here on a button and it will start like spinning. And it will select somebody. Okay? So let's go with the first candidate for free access. It's going to be, let's see. Come on. There's a candidate here, nurse here, Eugene de la Cruz from the Philippines. So Eugene, if you're here, make sure you contact our academy to receive the free access. And my advisors, write these names down, okay? Eugene de la Cruz from the Philippines. The Wheel. Okay, that's the name, the Wheel, you see? English as a second language, you forget words sometimes. The Wheel, spinning the wheel. Wow, that's not too hard. All right, so Eugene, first one. All right, let's do another one. 3. So Grace from Nigeria. Grace, I don't see a last name. So hopefully there's not 10 Grace. But if we have 10 Grace, we might run into a problem. But Grace from Nigeria, you have free access to our membership. Contact our advisor as well. And the third one. Whoa, this is hard. Ogunsuyi Modupe Kemi from Nigeria as well. Sorry if I destroyed the name. I did the best I could. So this is our third winner. And let me see. Let me see if everybody follow the rules here. We have 705 likes. Wow. Let's do one more. I'm gonna give one more. Okay? So the last one, the final member to receive our free access to our membership is going to be Sadija Branch from America. So congratulations, Sadija. Welcome to our membership. And that is the last one for today's live training. All right, guys. I think we're done. I'll see you tomorrow in our day 2 of our 7-day training. Do not miss it. It is very important for you to be here in this live training. We're going to talk about very interesting topics. We're going to see new style of questions. And the most important thing is that other members will have the opportunity to receive this free access to our membership. I wish God bless you, all of you, and let's pass the Nclex. Thank you for being here. Remember, subscribe to the channel if you haven't done it yet. Share this video with everybody, the whole world, so they can see tomorrow's training, day 2, our next generation Nclex 7-day training. God bless you all. Bye-bye.